So picture this. You're out grabbing a quick lunch, maybe getting a couple of tacos topped with some crisp, shredded iceberg lettuce. You probably don't even think twice about it, right? But right now, something as simple as that lettuce, specifically lettuce sourced from Mexico and served at various Taco Bell locations, is actually at the center of a massive public health emergency. Welcome to today's Explainer, where we're going to take a really close look at the July 2026 Cyclospora outbreak. It's this fast-moving situation that hasn't just made thousands of people sick, but has honestly exposed some incredibly deep systemic cracks in our nation's public health safety net. So let's dive right into this. 3,300. That's a huge number, right? Well, to really wrap our heads around the sheer scale of what we're dealing with here, we have to look at Michigan. Michigan has essentially become the epicenter of this crisis, with over 3,300 reported cases. For a state health department, being hit with this many cases of a foodborne illness all at once is an absolute logistical nightmare. It's an entirely unprecedented wave for the summer season. Just to put that into perspective for a second, during a typical summer, Michigan expects to see about 50 cases of this infection in total. Compare that baseline to July 2026, and the contrast is absolutely staggering. We aren't just looking at a somewhat bad year, we are looking at a historic anomaly. And it's stretching our state and federal tracking systems to their absolute breaking points. Here is our roadmap for this explainer. 1. The Cyclospora Outbreak. 2. Tracking foodborne illnesses. 3. Cracks in the system. 4. The political blame game. And finally, 5. The cumulative impact.
All right, let's jump right into Section 1, the Cyclospora Outbreak, and the microscopic threat behind it.
So at the center of all this chaos is Cyclospora. It's a parasitic infection that's notoriously linked to fresh produce, specifically leafy greens. Right now, this parasite is driving a massive FDA traceback investigation that's tracking 1,644 illnesses across a 5-state cluster. We're talking Indiana, Kentucky, Michigan, Ohio, and West Virginia. And the primary suspect in all this? Shredded iceberg lettuce from Mexico. They've actually issued warnings advising people not to eat this lettuce at Taco Bell locations in those states, and restaurants have temporarily stopped serving it entirely while the investigation continues.
Moving on to Section 2, tracking foodborne illnesses and detecting these dangers.
You know, a really major part of our detection network has historically been something called FoodNet. It's a federal monitoring tool designed to track pathogens across 10 different states. Public health experts rely heavily on this active surveillance because it provides essential baseline data to monitor trends over time. Basically, when cases spike, FoodNet is usually the very first alarm to go off. But of course, FoodNet doesn't operate in a vacuum. Think of our public health net kind of like stacking slices of Swiss cheese together. Every individual slice has holes, but if you stack enough slices on top of each other, the holes eventually get covered up. Cyclospora investigations rely on multiple complementary layers working together. You have state public health laboratories identifying the pathogen, CDC case reporting aggregating the overall numbers, molecular epidemiology zooming in on the DNA of the outbreaks, and FDA traceback investigations hunting down the actual source farm. Even with changes to any single program, officials heavily rely on this entire overlapping surveillance network to catch the threat. Which brings us to Section 3, cracks in the system and some newly exposed vulnerabilities. So remember FoodNet we just talked about? Well, it actually got scaled back. Just last year, the Centers for Disease Control and Prevention reduced the number of pathogens that FoodNet strictly required states to report. They dropped the mandatory list from 8 down to just 2. And cyclospora tracking, that was made totally optional. Now, while federal officials note this hasn't hampered their immediate response, independent food science experts point out that this was a really, really poor decision. By making cyclospora tracking optional, we essentially threw away a crucial tool for collecting valuable long-term data, literally right before a record-breaking outbreak hit. And you can see the fallout on the ground, which is incredibly grim. Dr. Natasha Bagdasarian from the Michigan Department of Health and Human Services points out that public health teams are working around the clock right now. They're pulling staff from other jobs entirely just to do highly manual work in a system that is dangerously close to being overwhelmed. Investigators are literally relying on outdated databases, manually entering data, and calling up sick patients to try and get them to remember what they ate at a fast food joint weeks ago. I mean, could you remember exactly what you had for lunch 3 weeks ago? It is grueling, highly resource-intensive work.
Let's look at Section 4, the political blame game. Who exactly is responsible? As you might expect, Democratic lawmakers are pointing a finger directly at the current administration. Representative Pete Aguilar argues that health employees were, in his words, doged and were cut.
noting that having fewer resources and fewer people protecting communities is just the new reality. Others, like Michigan Haley Stevens, argue that federal budget cuts and workforce reductions by the Trump administration have actively dismantled critical safeguards. They argue this has left states vastly more vulnerable to outbreaks exactly like the one we're seeing today. But on the flip side of the aisle, you have a very immediate counter perspective from the federal health agencies themselves. An FDA spokesperson firmly disputed any suggestions that staffing changes affected their investigation, stating pretty clearly that they have the expertise, personnel, and resources necessary to detect, investigate, and respond. Furthermore, CDC officials note that their internal processes and systems for this specific outbreak remain entirely unchanged compared to previous seasons. They added that the investigators actively involved in outbreak responses were explicitly not affected by any recent workforce reductions. And that leads us to our final part, Section 5, the cumulative impact and the overarching consensus. Because when you talk to independent experts like Darren Didwiller at Northeastern University, they'll tell you that public health systems rarely ever fail because of just one missing position or one specific policy. It is cumulative. When you really break it down, funding saw some brief increases post-COVID, but that was followed by years of total stagnation. Technologically speaking, we are still relying on outdated, highly manual databases. And when it comes to staffing, it's the slow, quiet accumulation of small reductions that ultimately drains institutional knowledge over time. The system's fragility isn't born from one single political decision, it's the result of chronic, long-term resource strain. Which honestly leaves us with a pretty crucial question to think about. As our public health network stretches to its absolute limits just to track tainted lettuce in the Midwest, what happens when the next, potentially much more dangerous outbreak hits? If our defense layers of funding, technology, and staffing are continually thinning out, we really have to ask ourselves how long that Swiss cheese model can hold up before the holes line up perfectly. Thank you for joining me for this explainer. Keep a close eye on what's on your plate and stay curious.